Good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. I'm back. Did you miss me? I want to thank Jonathan for covering for me last week. I had some time off, which I definitely needed. So really glad to be back, well rested, and have some great and new information for all of us. So excited for that. But before we begin, just a reminder about our mission here at Health Plan Markets, and that is to serve those that serve others, which is you. Our whole goal and idea here is to ensure that we're delivering exceptional systems and guidance. So extraordinary systems and guidance specifically is in our mission statement. So if we are missing the mark on that, or if you feel that we could step it up, please let us know. We're going to show you some ideas on how to do that, but specifically, you can call us, you can email us. We always want to make sure that we're delivering our best for you because we know that you have a choice in FMOs. So thank you for being here early on a Monday morning, and we'll get this thing started. So good morning to everyone. We've got quite a bit of attendees coming in. Also, as a reminder, if you have any questions during our call this morning, you can go ahead and put them in the chat. John and Mike are manning it. I think Nick's on there too. So if you guys have any questions, concerns, or rude remarks, they'll be glad to answer them, or at least read them. So they're there. All right, so as we begin here, I'm going to go through our agenda. I'm going to share my screen here. I'm a little rusty, guys. It's been a couple weeks. Let's see. Share screen. And I'll just show you the whole window. How about that? We'll do this one here. Okay. So if you can see my screen, please give me a thumbs up somewhere. That'd be awesome. Just let me know if you can see it. All right, thumbs up, we got it. All right, so this is HQ. If you don't have HQ, then you are missing a lot here. So please make sure that you reach out to support@askhpm.com, or you can call us at 844-696-3975, and we will get you set up with HQ. If you forgot how to log in, we're glad to help you and walk you through that process. So this is Rome. All roads lead to Rome. Anything that you need or touch should live here in HQ. This is what we preach internally, and we want to make sure that we preach externally as well. Mike and his team work really hard. This is the product that HPM has designed, is HQ. And essentially, our goal is that you start your day here, you work your day here, and you end your day here, as far as work is concerned in your career here at HPM. So as a reminder, let's go through the training calendar. We're going to go down to learning. And we've got some new links we're going to talk about in a minute, but we'll click the training calendar, and this is all the training for the week. I like to go to week view just because it's a little bit easier to digest. So we've got a special guest here today, so we're going to talk about Devoted. And so at 2 o'clock today, Devoted is doing their National Agency Summit. So we'll be joining that to figure out what is going on with Devoted for the rest of the year, so stay tuned there. That's at 2 o'clock. Tomorrow, which is August 26th, Tuesday, we've got Health Spring. Remember, Cigna is now Health Spring because they were purchased. So you're probably not going to hear Cigna Medicare anymore. You're going to hear Health Spring. So just a reminder that that has already occurred and that's happening. So Health Spring is doing a kickoff for Central Florida at Brulando, and that is at Hoffner Avenue at 1:30 tomorrow, Tuesday. So you can check that out if you're in the Orlando market. And then also Devoted at 3 o'clock is hosting an Understanding 2026 Part D and Extra Health Benefits. This is really going to be important and could set you apart from other agents just by knowing what is going on with Part D. I've always been a very big advocate on learning Part D because it's going to come into play in a lot of different areas as you're navigating and helping clients. So that's at 3 o'clock. Devoted's doing another training on Wednesday, same thing there at 9 o'clock. We have our Al Clancy available at 9:30 on Wednesdays for a virtual coffee and chat. He is open for a full forum. If you feel lost, confused, not knowing the next steps, wanting to take your business to the next level, this is the guy that you're going to want to talk to. So he's available every Wednesday at 9:30, from 9:30 to 10:30. Mark your calendar, jump on there. He's available, and he wants to make sure that you're leveling up as an agent. Okay. All right. Devoted's doing a rollout on the East Coast. This is in Palm City. So if you're in that market, they're doing their rollout session from 11:30 to 3. We are not going to have every rollout session on this training calendar because there is a lot of rollout sessions. It's carrier times state times county or times sales area. So the best bet is to please check your emails. And we're going to talk about rollouts in a bit. Spark's doing an intro call to cross-selling, and that's on Wednesday at 12 o'clock. We've been really kind of talking more about the cross-selling opportunities, especially with United One. This is a way to kind of, navigate that space and figure out how do I cross-sell if you've never cross-sold before. This is a great opportunity to do so Wednesday at noon. Moving over to Thursday, Devoted's doing a Kissimmee broker rollout. This one's in Espanol, 2 o'clock. And that's Thursday at the 28th. So check that out, 2 o'clock, if you're in the Osceola market. We're doing an HPM HQ intro, which is our platform that we're on here, and that's being hosted at 3 o'clock on Thursday. And then Friday, we've got Tom Ryan with all of the HPM selling tools available. He'll go through that from 9:30 to 10:30 on Friday, August 29th. That is the training for the week. Remember, guys, always keep one foot in the classroom and the other one in the field at all times. Whether you've been in this business 5 minutes or 5 years, it doesn't matter. Things are shifting all the time. So you got to know this information. You got to stay on top of your game, because how will you help your clients if you don't? Okay. So super, super important that you get that done. All right. It's recertification season and it is hot, hot, hot. Thank you to the tech team here at HPM. We've got recertifications 2026. So if you go under contracting, recertification 2026, you will see all of the great things that are rolling out. AHIP 2026 is live. We do really recommend that you use our link. If you're going to go the AHIP route, just make sure that it has the Health Plan Markets logo like you see here in the top right corner. We need to make sure that we are distributing enough links, otherwise AHIP will shut it down. We were able to get a $50 discount for you. So instead of the price being $175, it's $125. If you haven't done your AHIP now, it's August, and you're less than 2 months away from AEP, and you really got to start moving. So please make sure you get your AHIP done. Use our link. It's in HQ. Boom. It's at the top right when you log in. FFM, the Federally Facilitated Marketplace, also known as the Affordable Care Act, Obamacare, whatever you want to call it. It is here, individual and family plans training for on Marketplace for 2025 is closed. So you can't cert for FFM right now. There's a blackout right now until they load 2026. That's coming soon. As soon as that's loaded, we will let you know. There'll be a notification inside HQ. And then we will notify you here on this call to make sure that you guys know that FFM is rolled and it's ready to go. Carrier trainings are live for recertification. Now, one thing that I want to make note of is the fact that not all of them are live yet. So you'll see that it says coming soon here. So Paycare is coming soon, but Cigna's live. Mike, of note, we're going to have to change this logo if we've got a new HealthSpring logo, and then reorganize that. But as they become live, you can click here and all the instructions on how to recertify will be right there. So it's going to make it very easy for you to keep track of your recertifications. So Devoted, for instance, theirs is live. You're going to click Devoted and you're going to scroll down and you're going to see, okay, this is how I recertify. Okay. So one thing, if you're not contracted with the carrier, please do not go through the recertification area. That's not where you go. Okay. You're only going to do the recertification area if you're currently contracted for the last plan year. So if you were certified for 2025, then you're going to recertify for 2026. If you're a brand new agent, you're not going to go this route. You're going to go over to contracting. You're going to go to all carriers. Once you click all carriers, for instance, if you want to get contracted with Devoted, you're going to scroll down to Devoted and you're going to click Get Started. Okay, so if you're new to Devoted, you're going to click this, and quick description up top with all of the states that they are currently doing business in, and then instructions on how to start a new contract. Or if you're transferring over to HPM with Devoted, you're going to click Transfer Existing Contract. And so we'll get you set up that way. Okay, so want to make sure that that's clear. Let's talk about carrier rollouts. We don't have it on here yet, but idea for the team I'm talking, and hopefully they're listening, John, Mike, is to create a section for carrier rollouts. So carrier rollouts are important. Specifically, what we're looking for is what we call first looks, and I think that's really what we want to focus on is first looks. Typically, you'll see first looks. We're seeing a lot of it behind what we call a firewall. So you have to log in to United Healthcare to see their first looks. You might have to log into your Devoted portal to see first looks, or they might send out a PDF. So anything we can gather, I think would be a great idea. We can put it in the learning section. If you guys like that idea, give me a thumbs up or give me a chat that you like that, as far as all the first looks are concerned. Having a place that you guys can reference that. I got a hell yeah. So he likes that. Claudia likes it. Awesome. Appreciate that, guys. Yeah. So the first looks is great. Remember, these are not final benefits. The final benefits, you will get notified with the summary of benefits that will launch in the kits. And even that sometimes might have mistakes. So just be on your toes until about mid ADP, is really where you're going to have everything going. It's pretty much locked and loaded as far as accuracy goes. But stay tuned here. This is the call throughout AEP that you're going to want to be on in case there's any quick changes. We want to make sure that you guys are notified early and often. So, team, if you're listening, Mike or John, let's work on that first look page. I think that would be a killer for our team here. We talked about AHIP. We talked about the carrier rollouts. Again, on carrier rollout sessions, we see that Devoted's doing theirs. We're seeing quite a bit of other carriers that are hosting in your market. So please make sure that if there's a physical rollout session in your market, in your area that's within driving distance, please go attend it. There's a couple reasons why. Number one, you're going to learn something. Holy smokes, right? You're going to stay on top of what's going on with that particular carrier. You're going to know different opportunities. They might even spell it out for you to say, hey, this is a plan you're going to sell and here's why. And then oftentimes you're going to network, either with the carrier rep, or other agents. So there's a lot of opportunities there. You might even meet some doctors. Go to the rollout sessions. Go there. Be present. Show up, especially because if you really don't know what plan is going to be hot for what reason, this is exactly why you want to do it. If you're new to the market, if you're new to the business, this is an excellent way to level up your business just by going to these rollout sessions and being present. And I'll tell you what, you will be probably the 10% that actually show up, okay? When you show up, you're going to earn, right? So please show up, okay? Last little bit I want to share with you before we pass the mic over. Nick, I don't know who is representing Devoted today. If you want to shout at me while I'm talking here, and I'll look for them. Oh, Jimmy's on. We'll use Jimmy. Probably Jimmy.
It will be the Jimmy.
It will be the Jimmy. I love the Jimmy. All right. So we're going to pass the mic over to Jimmy. But one last thing I want to show you guys on HQ, I'm really, really excited for, and thank you to the team for bringing this. Thank you to Sergio and Nick for bringing this to HPM. They've been working on this for quite some time, and Mike got it live last week, and we have continuing education here at HPM. Okay, so this is WebCE, and they have hooked it up. This is so amazing. So two things. The first is all of you need to have continuing education credits. So we call them CEs. continuing education credits is required in order to maintain your license. So instead of scrambling at the end of the year to get your credits, which most of us do anyway, right? We have baked it into HQ, so you can go out here and you can take courses to get your CE credits. Also, if you know somebody that wants to get their license, you can send them over here, and we have a Health Plan Markets link, which is here when you click it, that you can send over to your friend or family member to get licensed through FCE, and it's super, super cheap. It's amazing. So you can prepare, you can do your exams, you can maintain your CE credits, and then obviously expand your knowledge base. So it's there. If you need any help, Mike and the team did a fantastic job, building out the phone number and the email. So really, really excited about the IT team. They did a fantastic job. And then how to pick out courses, it's all listed here, beautifully executed, so you guys can follow along and get yourself set up with CE credits. So really excited about this. This is a new feature. Very, very proud of the team on getting that done. If you like that, give us a thumbs up or give a clap or whatever to the IT team, because they've been working overtime on getting that done. So we appreciate that. Nice. All right. With that, let me go ahead and pass the mic to the Jimmy Feliciano. I'm going to make you a presenter, brother. So this should come up in a second. It takes a minute to connect. But while Jimmy is connecting here, Jimmy and I go way back. This is like my brother from another mother. I mean, we're almost identical anyway, right? So Jimmy and I came up as agents together, and we've known each other for a very long time. And so proud of the work that he's done at Devoted. He's like the chief boss over there now. So he's here to give you the good news about Devoted, what's happening to close out 2025 and 2026, and all the good news that you guys need to know about Devoted. So please listen up, take notes, grab your pen, paper, because he's going to give you some secrets here as well. So Jimmy, what's up, man?
Justin, you're amazing. So great to connect with you and the team here. It's been a while, but you guys are always doing great things. I love what you're doing all the time.
Thanks, man. Appreciate that.
Yeah. So I'm kind of gonna zoom through a few things. I know we have a limited amount of time, but also want to give an opportunity for some questions. So I'll give you guys some quick updates on Devoted. I think 2026 is going to be a huge growth year for us. Let me see if I can share a tab here. Give me 1 second.
Yeah.
Make sure I get this right. Can you guys see that?
Yes, perfect, man.
Awesome. So 2026 is going to be huge for us. 9 new states, 999 counties. I wish I could say that we were shooting for 999. I love the number. It's an easy one to remember. If we did a quiz, everyone's going to remember it, right? But yeah, 999 counties nationally. That represents 45% of where Medicare eligibles or Medicare Advantage population lives. And our goal, as many of you know, is to continue to scale the United States. We want to get to where 90% of Medicare eligibles live eventually. So we'll continue to expand year over year. The good news for you, if you're an agency like Health Plan Markets, and for those agencies that work with Health Plan Markets, it's always a great opportunity to expand your business and grow your business with us. You can go to any state, and most of the brokers in any of those states have the major, top 3 carriers nationally. Very few know about Devoted. People are starting to learn about Devoted. So there's a lot of growth opportunity there. Maybe they'll join you and get the contract with Devoted. If they love you, they'll switch all their other contracts. So anytime there's a company like Devoted that's scaling nationally, it's a huge opportunity for agencies and brokers to scale and to grow with them. And by the way, no one has grown nationally or entered the national scene for over a decade. So this is uncharted territories in the US right now, and Devoted is doing a pretty amazing job at it. I would tell you that one of the things as a brokers I would pay special attention to as you build your book of business is star ratings. Star ratings are the mechanism that determines who's going to have a funding advantage year over year. And so here's a pop quiz for you. In 2024, can you guys guess how many How many CMS contracted plans had a 5-star in 2024? If it's 38, if you guys guess 38, that's a good guess. It was 38 contracts. There's over 550 CMS contracts, by the way, nationally. So
Wow.
a lot of CMS contracts. 38 of them got a 5-star in 2024. 2025, that number dropped to 7 contracts having a 5-star rating. In 2024, you had over 88% of Medicare Advantage lives on a 4-star plan. 2024, that dropped to 62%. Why is that? That's because star rating cut points have gotten extremely difficult to achieve, and star ratings are critical. And if you just follow the headlines, right? 2 major carriers were in the courts fighting over their star rating. Why? Because it gives them a funding advantage. So if I'm a broker and I'm an agency and I'm thinking about how do I build a book of business that's sustainable, and that's geared for growth for the long term, you want to build with guys that have a star rating of 4 stars and higher. Why? Because that tells you who has a funding advantage for the next year.
Mhm.
And so the star rating you get for the current year counts for the next year. And so as a broker, that's one way to figure out where to go. Devoted has a star rating advantage nationally. We have 4.3 stars weighted average across the nation compared to our competitors at 3.95. If you look at membership, we have over 71% of our members on a 4.5-star rated plan compared to the national average of 30%. And if you were to look at a 4-star, we have 88% of our members on a 4-star plan or higher, where our competitors have 62%. So we have a funding advantage. That's what that means. We have a funding advantage for 2026. And I think you're going to see that with the benefits across the nation. So whether you're selling in Florida, or you're selling in Georgia, or the Carolinas, or Kentucky, wherever you're selling, you're going to see that we're going to have a funding advantage for 2026. Now, as Justin said, there's always a lot of change happening in the industry. You want to keep one leg in learning, as he said, and one leg out in the field. So you always want to be learning and growing, right? And so VBID is going away. I think you guys have heard that by now. It's a major impact to duals. Duals will no longer automatically qualify for the food and home card because of VBID going away. They now have to qualify through SSBCI, which basically means they need a qualifying chronic condition to be able to get the food and home card. I think for most duals, not a huge impact. About 92-93% of duals will automatically qualify. Most of them have 2 or 3 chronic conditions, but you're going to have about 7 to 8% of duals that won't qualify because they're healthy. So FYI on that. The other major impact is the Part D. In 2025, anyone you put on a dual plan gets 0 cost shares for their prescription drugs. That won't be the case in 2026. You'll start to see some LIS copay levels on Part D for dual. So be aware of those things. Those are really important things to keep top of mind as we go into 2026. So what is Devoted doing? We're bringing some C-SNPs. I'm going to tell you a little bit about that here in a second. But because of VBID going away and because of the changes to VBID, we're separating OTC from the food and home card. So you're going to have a separate OTC benefit that they can use. So they can use their Devoted card, go into any CVS and get their over-the-counter benefits. We're going to continue to see the food and home card. I think we're going to be top of market here in Florida and really throughout the nation with the food and home card. And I'll tell you a little bit more about that here in a sec. We're going to increase allowances on dental. We'll have 2 types of dental. We'll have a network benefit for our SNP plans, so C-SNP and D-SNP, and we'll have an open access benefit, meaning for give back and 0 premium and non-SNP plans, where they can go to any doctor in network. They do have to pay up front and they get reimbursed. The cool thing with Devoted, we're averaging 5.7 days on the reimbursement. So we get that money back to them really, really fast. All they have to do is send us a text message, pay me back. We start that process, and it's a pretty smooth process here at Devoted. And then we're adding a separate vision benefit, so they'll have a separate vision allowance they'll be able to utilize for 2026. Pretty excited about all of that. What are the type of C-SNPs we're bringing into market? This is new for Florida. It's not new nationally. It's not new on the West Coast, but it's new for Florida. We're going to bring C-SNPs that are dual focus. So these are C-SNPs for duals. And there's 2 types of C-SNPs. One is the C-SNP Plus, and that's for cost share protected duals. So if you're new in the business, that means they have to have QMB, QMB plus, Slim B plus, or FBDE, and that would be a great fit for them. Or we're also doing one for LIS folks. So if they're not cost share protected, maybe they're QI or Slim B, or they only have LIS, the C-SNP premium would be a great fit for those folks. These are group 4 category C-SNPs, which means they have to either have diabetes, chronic heart failure, or cardiovascular disorder. On the membership attestation form, there's a whole list of conditions that fall under these categories. So if that's a question, I promise you when you see the member attestation form, you'll see the whole list of conditions that fall under these different categories so that you can help prospects if this is the right fit for them. So we're really excited, guys, about these C-SNPs. And actually, it's going to provide you an extra tool in your bag for selling. We're not competing against other C-SNPs in the market, but after AEP and OEP, if you have a QMB, if you have a QI, if you have a Slim B, if you have an LIS person, as you guys know, they don't have an SEP all year round the way the fully integrated folks do, or the full duals do. So here's an extra tool in your bag to be able to sell Devoted, to be able to sell another product throughout the year. And again, we're launching these products nationally. So this is not just Florida, you know, Georgia, the Carolinas, wherever you go, you're going to see these products with Devoted. This is our product map, or our product types in Orlando. I'm using Orlando as an example, but pretty similar across the nation and pretty similar across Florida. So 0 premium plan, give back. We're introducing a new full dual plan to get a little bit more competitive on that food and home card. We're going to continue with the dual plus plan and a partial dual plan, and the C-SNP plans and the premiums. But if you were to break it down, guys, the full dual plan is just for cost share, full duals. So QMB plus, Slim B plus, FBDE. For QMBs, they can go to the dual plus plan. And of course, if they're a QMB and they have a chronic condition, they're going to love the C-SNP plus plan a lot better. So we have some options here for you guys. Let me actually switch my screen. Can I do that? Let me see, how do I do that? Let me stop sharing for a second. And give me a second here, Justin.
Sure. Take your time. We've got some questions in the chat as you're doing that, and I'll do my best. Rebecca's asking, where can I find the membership attestation form? I'm assuming that's probably in the Devoted portal. Is that right? Or it's in the packet?
Yeah, it's going to be in the member in the agency portal or agent portal. When you do an application, after you're done with the application, if it's a C-SNP, you're going to get the member attestation to pop up right away after that, so you can fill it out along with the HRA. By the way, guys, not only have we continued to pay commissions on all plans, and we'll continue to do that for 2026, but we're also paying HRAs on all plans. So, you know, after you do an app, you'll get the member attestation, you'll get the HRA that pops up, and we'll pay you guys for that as well.
Yeah, I'm pretty sure it's automatic in HPM Shop Connector. So that membership form should pop up at the end of the enrollment process, Rebecca. If for whatever reason it gets missed, no doubt Devoted is going to reach out and get that done between you and the member, probably on your behalf, because we've seen how amazing your guys' agent support is. It's awesome.
That's true, and but definitely will be in the app workflow process, and if you order apps, that'll be included in the paper apps as well.
Cool. All right, so we've got some more questions, but I want to let you finish up here.
Okay. C-SNP plus. So there is a Part D premium on this. As you guys know, if they're cost share protected, they're going to have LIS. LIS will cover the Part D premium of $4.80. So not a lot, by the way. For those who are thinking there might be some other use cases for this, if someone has a group 4 condition, but basically, guys, you're going to get a summary of benefits, and it's going to have 2 columns. One column is going to show the max cost shares for someone that's not cost share protected, because technically anyone that has the group 4 condition can join this C-SNP. So technically you'll have one column with max cost shares, but it's not going to be a good fit for them, because as you see here, if they don't have the cost share protection, they're going to pay $2,230 per stay at the hospital. Not ideal for someone that doesn't have the cost share protection. If they have the cost share protection, there's going to be a separate column that shows zeros from top to bottom. So hospital, outpatient, all the benefits are going to show zero cost share for those folks. So you'll see that. On the Part D, if they have LIS, if they're cost share protected, they're not responsible for the Part D deductible. And then these cost shares you see here won't be applicable to folks who are cost share protected and have LIS. They're going to pay their LIS subsidy for generics and for brands. The one exception being, guys, that for a tier 6 drug, which it's an adherence drug tier for us, those will be a zero copay. We'll have a list of those available for you as well so that you can review them. The food and home card, $490, guys, on the C-SNP Plus. That's a lot of money. They can go to Publix, they can go to Walmart. We're adding Sedanos for 2026, so they'll be able to go to Sedanos. So a lot of money they can use for food, they can use it for rent, for mortgage, they can use it for utilities. So they have a lot of options and flexibility there. They'll have a separate OTC allowance of $50 per quarter. We're giving them a dental limit. Remember, this is a network-based dental benefit of $3,500. So that's gone up from where we're at on the D-SNP side. Eyewear allowance, $300, wellness bucks, $150, and then you have the fixed copays here for hearing aids. So I don't know about you guys. I think we're going to sell a lot of this throughout all of Florida. And that number is relatively the same throughout Florida. And again, if you're in a different market from Florida, you're going to see that that number is going to be top of market as well in whatever market you're in. So super exciting benefits there. And then for the C-SNP premium, again, this is for those folks that aren't cost share protected, maybe have LIS only. It might be QI, they might be Slim B. I think great benefits here as well. The premium for the Part D is $4.80. If someone can afford $4.80, even if they're not LIS, I would pay it, guys, on this plan, because they get a $240 a month food and home card on this plan. So you exchange $480 for $240 on the food and home. Makes sense. A lot of the copays are going to be like a traditional zero premium plan. So again, a lot of opportunity there to sell another thing in your bag to sell that you can sell all year round. And then we have the full dual plan for those that aren't, for those that don't qualify for a chronic condition. That has a $426 home and food card. So this is, again, Quimby plus, Slim B plus, FBDE. Great benefits there, zeros across the board, with great supplemental benefits there as well. And we have our dual plus, which we currently have in market. That's pretty much staying status quo. So if they're Quimby and they don't have a C-SNP condition in the group 4 category, they would go in this plan, and the food and home card is $263. And again, I think that should be competitive when you look at what's happening on the landscape for those folks that don't have a chronic condition. I'm always very honest. We really don't compete in the partial space, so that's not our space. You could probably put that somewhere else. Give back, I haven't seen all the competitors yet, but I think our give back's probably going to be near the top across the nation and in Florida as well. For those who don't know, the give back, the Part B premium is probably going up to about $206.50. So $184.70 is going to make a huge impact for those that are looking for that money back. And then we have our zero premium core product. Again, if you look at our C-SNP premium plan, if they have a group 4 condition, paying those $4 to be able to get the $240 food and home card, and the copays are going to be relatively similar, might make a lot of sense for those folks depending on how Part D looks if they don't have LIS and what that situation might look like. All right, I'll pause there. What questions do we have, Justin?
Yeah, beautiful job, by the way, Jimmy. Like, these benefits, it's like Devoted's back. You know what I mean? Like, we've been waiting. So we had to wait 12 months, but here we are. All right, so Elise is asking, Devoted has an extensive list of qualifications for C-SNPs. Has that list changed?
So that's not a list for C-SNPs. It's important to make the distinction between C-SNPs and SSBCI. So for folks that are on the core plan today, the way they get their food and home card is through SSBCI, and there's like 40 qualifications for that. C-SNP is different, right? That's a different qualification. It's a plan versus a benefit. And so keep that in mind. For the C-SNP, the group 4, again, is diabetes, cardiovascular disorder, and the congestive heart failure, and there's a list of conditions that fall under those categories that you'll find on the attestation form. So that's important to remember. For the SSBCI, remember, everyone in the industry is going to SSBCI with the food and home card because of VBID going away. That list is going to be a lot larger. I'm not sure what that list is going to look like for 2026 yet, but you guys will have that information by sometime in September.
Right. And if Sergio's listening, this might be a great training opportunity, is the SSBI benefits, SSBCI benefits, because that's a big gap, I think, that the agents are missing there. They're asking, is this PPO HMO? I only saw HMOs, but do you have CSNP PPOs out there?
Yeah, so Florida, think Florida HMO. Outside of Florida, we have PPO markets, and PPO markets is going to be a CSNP PPO, and HMO markets is going to be a CSNP HMO with the same layout and structure.
Cool. And Align is asking, cost share folks will have cost share dual plus, question mark.
So cost share protected folks that qualify for the chronic plan will have the CSNP plus. Those that don't qualify for the chronic plan that are QIMB plus, SlimB plus FPD, so they got to be full duals, not just cost share protected, will qualify for the full dual plan. And the QIMBs, if they don't have the chronic condition, will qualify for the DSNP plus plan, which is what we have in market today, Align.
Awesome.
By the way, shout out to Align. Love you, brother.
Yeah. So on the SSBCI, Rebecca's asking, she'd like to know the SSBI level there. I really think that we should probably do a training on that. That's popping up a lot because it's relatively new, is like how these qualifications work, how to identify those particular individuals, because the last thing that we want is a rejected application, right? Like we want to make sure that that person qualifies.
So remember, and I'll pull something up here. Give me a quick sec here.
Just want to make sure the agents are like clear on like the differences and what that means.
Yeah, this should be helpful. So remember, when it comes to CSNP, they have to qualify for the plan. By the way, our process, Justin, I know you guys are all experts at CSNP verification and all of that. Our process is going to be pretty cool, pretty simple. So when you submit the application and the attestation comes in, once CMS approves the app, we will start the verification process before the app is effective. So you write something on October 15th for January 1st, and it comes back from CMS approved on October 18th. We're going to start the verification process way ahead of time to give us the runway we need to actually get this validated. And we're going to do multiple things to make that simple for you guys. We're going to send a fax to the providers you list on the attestation form. By the way, I would encourage you to list 2 providers if you can. You'll have space for 2. So we'll send out a fax to them. We're going to start calling them within 5 to 6 days after we send out that fax to try to get that validation. If for some reason that's unsuccessful, you guys will have the validation form in your portal online that you can get. If you know the provider, you have a relationship with them, you can go get that filled out. You can upload it into our agent portal and get that approved as well. If for some reason that's not successful, we have devoted medical internally, and we're going to do what you call D2Me visits. D2Me establishes the relationship with that person, and that provider on the devoted side will try to validate that condition as well. So we're going to have 4 or 5 channels that we use to try to validate those conditions to make sure that they don't slip, through the gaps, if you will. But as you guys know, you have 60 days from effective date to get that validated. If not, they get an SEP and they'll have to switch plans. But we'll make that pretty simple. So I want to make the distinction again, Justin, between the CSNP. So if you don't have the chronic condition, you won't qualify for the CSNP plan.
Right.
But if you join the DSNP plan and you don't have a chronic condition, you won't qualify for the benefit, the food and home card benefit, but you'll qualify for the plan. You get the distinction? So they're not going to lose the plan. They just won't qualify for the food and home card. So that's an important distinction just to keep folks aware. And then with the SSBCI, for those who are not aware, SSBCI stands for, I know a lot of acronyms in our industry, special supplemental benefits for the chronically ill. And so for those who have a qualification for that list is a lot wider. It's probably going to be 20 conditions. It might be 15 with some plans, might be 30 with some. It depends on the plan. and it might be obesity, right? It might be high cholesterol. It might be a number of conditions that most folks have. So that's different. SSBCI qualifying for that benefit from C-SNP and qualifying for the actual plan.
Right. So SSBCI opens the door for those additional benefits that you were discussing specifically on the D-SNP plan. Otherwise, that door closes if they don't have that, but they could still qualify based on their Medicaid status.
That's correct.
So,
Yep.
yeah, man, I think that's a whole class in itself, to be honest with you. I mean, you and I, we could talk shop all day because we've done it, right? But it's amazing. Let me say, by the way, Jimmy, like this is probably the most interactive call we've had in a long time. We've got tons of questions, so I'm not going to have time for all of them. People are loving the benefits, what they're seeing, great benefits. So Jose's asking about seminars. I love you, Jose. We're going to work with Jimmy behind the scenes on that. If you are interested in working events with Devoted, just reach out to Jose Aguayo on our team, and he'll put you down for, it may be seminars, it may be tabletops. We don't quite know yet. We'll get with Jimmy's team on what's available in our market and what we can do to work together on that. There's a big question here. This one's from Luis. And by the way, Jimmy, if you don't mind, if you want to share any contact information, I know you're head honcho over there now, so I don't know if you're the person that they need to talk to, but maybe just your email address, and then you can route them wherever you want. You're pretty good with email, better than I am, by the way. But while you're doing that, Luis is asking, we've seen reports that many prior authorization denials are overturned on appeal, but appeals are rare. What's your current rate of denials and appeals? How are you working to improve that experience for providers and patients? This is a hard question. This is tough love, I think.
It's a great question. Someone is following the headlines in the industry, so that's a good thing, right? Like, awesome. So I don't know the rate, but I will tell you that's never been a problem with Devoted. Anybody that's worked with Devoted knows that we approve pre-authorizations typically inside of 72 hours on our standard, and typically inside of 18 hours when they're expedited. So we're really fast with that. We don't typically deny them unless there's a real good reason to deny them. And so we haven't had that issue. Actually, that's our selling point with hospital systems as we spread across the nation, which is why we've been successful actually getting contracts with hospitals. They love our process behind the scenes, especially in that area.
That's amazing. I know we're short on time, so you guys have great questions in here. We didn't get to answer all of them, but I will encourage you, if you haven't already signed up for a rollout session with Devoted in your market, please go to them. I already talked to you about why you need to go there. Please go to the rollout sessions. Jimmy's spending a lot of money on making sure that you're wined and dine at these things. They're really, really nice, and you're going to walk away with value, which is very, very important. So that's there. Nick is also reminding us of our kickoff, but that is an invite only. So be prepared if you haven't seen that yet. It's an invite only this year because we went a little crazy last year. So trying to keep it lean and green. One last thing that I'm going to ask of you, Jimmy, is a question that I always ask my colleagues here, especially since you and me used to battle it out on the front lines. You've seen everything, man, from top to bottom, in and out, up and down, right? No matter where these agents are in their career, 2025 going into 2026, what would be a piece of key advice if you were out there on the street selling today? You had to hit that reset button, and Jimmy Feliciano, the man, the myth, the legend, is going to go back out there with his sword and axe and try to grow his book of business. What would you do?
It's a great question, Justin. I've actually been thinking about that a lot. Not leaving the carrier side, but how would I build my book?
I'll tell you what. You've seen the new commissions that these guys are getting, right? 11% increase. I'm like, man, what am I doing over here? I need to go out and sell again.
That's pretty good.
Anyway,
so I don't know if your folks have heard of Charlie Munger. The late Charlie Munger was a legendary investor, and he's famous for being a business partner of Warren Buffett. In 1994, he launched a commencement speech on mental models. Now, a lot of folks haven't heard about mental models. Mental models are a way of making better decisions by taking learnings from different fields of study. One mental model that comes to mind is called second order thinking. And second order thinking is all about thinking about the long-term consequences of the decisions that you make. First order is, if I make this decision, this is what happens immediately, the immediate impact of that decision. Now, we all know, I know we have great benefits, but this is not how I would build my book of business. But we all know great benefits are kind of first order thinking. I'm going to put a lot of business with the plan with the, the juiciest benefits this year. That may be a good idea. It may not be a good idea. You kind of want to think a few levels beyond that. You want to think about star ratings. You want to think about service. You want to think about organizational operation and integrity. In other words, you want to put your business in places where it's going to be most stable so that you can continue to scale your business. You want to go from 200 lives to 400, from 400 to 600. I know you have some folks with 1,000, and I'm sure those folks want to go from 1,000 to 1,500, so on and so forth. Right? The only way to do that is by thinking, where do I put my business where it's going to be most stable for the long term? If not, they're going to play the game of turning over their business every year. So if I were to be a broker today and I were to be building a book of business, I would find 2 or 3 carriers that have stability, that have a funding advantage on the star rating side, that can service my book well, that will be consistent and have good business practices. And I build my book with those because I know over the long term, I could continue to scale my business versus having to turn it over year after year. So that would be my focus. Second order thinking, long-term consequences, not just thinking about the quick gains, but I want to make sure I build a business that lasts forever.
Yeah, I love that, man. That is fantastic. And that's different thinking, guys, and he's right. And look, yeah, he just described it, Devoted, and they're on the up and up, right? And I don't want to brag about this, but first market that Devoted was in, we were one of the first FMOs in the whole Devoted thing. So I'm pretty proud of that. And so thank you guys for, trusting in us on that. But here it is, guys. Devoted's back. Jimmy put his email in the chat here, jfeliciano@devoted.com. So if you do have any questions, concerns, shoot him his way, and himself or his team member will respond. They're very quick, especially to agent support. So, every minute that you spend solving member issues is a minute you're not selling, is a minute that you're losing potential income. So what Jimmy's saying is if you're going to have to chase your tail every year because of benefits, or you're stuck in customer service hell, then get yourself out of that and put your members into a plan. We're not gonna have to worry about that. And I will tell you, at the back end of my selling, I threw a few Devoted in there, and those are the people that are still on my book, and I can't get them off. Not that I want to, but they're there, So I don't sell anymore, but I'm still getting paid agent commissions from Devoted because they're taking care of those members like clockwork. So really think about that. Excellent advice. You got a lot of fans on here, Jimmy, and I know we went over time. I really appreciate you spending some extra time with us this morning.
You're amazing. I love your team, and you have a great agency, and I look forward to seeing you guys grow.
Brother, and we will see you in AEP, right? You'll be around. So absolutely, man. Thanks again, Jimmy. Everyone else, we really appreciate you guys being on the call this morning. We're going to do this same time, same station, same day, Mondays, 9 o'clock. If you know an agent that needs help, that needs to level up, please encourage them to be on this call. We're going to run these throughout AEP, and we're going to have exceptional guests like Jimmy, who just cracked the code for you guys on how to grow your business with Devoted specifically. And again, if you need some more information on Devoted, please visit one of the rollout sessions. We want to make sure that you guys go. I'm sure they'll have some free food. And if you're nice, you'll probably get a lollipop on the way out. Anyway, thanks again, guys. We will see you next week. Until then, happy selling and good luck. Take care, guys.